Excellent. Thank you, Aaron, and thanks everybody for joining us today on, yes, a beautiful fall day. The weather has certainly made a turn, and fall is deciding to be much more cooperative, at least at its outset, than the summer was. Um, as mentioned, Jesse Bridges, I'm the CEO here at United Way of Northwest Vermont, and excited to continue our partnership week with the Chamber of Commerce, Lake Champlain Chamber of Commerce, as we really celebrate United in Purpose. This idea that business success and social equity are together. They're not mutually exclusive. They are things that are important to the success and vitality of our community. At United Way of Northwest Vermont, we exist and work at the intersection of government and business and nonprofit and community. And we exist at that intersection because it's where we believe change can happen. And that's because we believe that no single organization or individual can do any of this work on their own. And our focus is on a number of key strategies. And the one that we are particularly here to focus on today is mental health, and in particular, mental health in the workplace. Mental health has been identified for a number of years as a strategic priority for the United Way and for our community. It's been an area that we have, as a community, struggled with. And I think through the pandemic have recognized that the issue of mental health is not just an issue that expresses itself on the streets or in the parks in our urban communities. It's not just an issue that expresses itself in our hospitals or in our designated mental health agencies like the Howard Center and Northwestern Counseling and Support Services. It's an issue that expresses itself for all of us in our homes, in our workplaces, in our schools. In order to improve and support mental health in our community, to make timely access to mental health a priority, to destigmatize the issue of mental health and hold it on equal footing with health overall, we need to continue to have these conversations about how we as a community work to support each other, how we work to all pull in the same direction, and how we all work to understand that the issues that we face, whether it be mental health, are not exclusive to that issue alone, that they're intersectional. If I am thinking about how I'm going to support my community and I'm thinking about healthcare and how people are doing in healthcare, I also need to be thinking about housing and where people are living and how they're living. And if I'm thinking about substance misuse, I also need to be thinking about how I'm supporting families or how people are achieving financial stability, because they are so all interrelated. Today, I am excited to introduce to you a couple of my colleagues who are working specifically around mental health and are leading our mental health initiative. Stephen Berbecco is the director of the Mental Health Initiative, and Adrienne Luzerman, who's also with us today, is working both with our mental health initiative as well as with the Prevention Network, which is helping to coordinate substance misuse prevention activities across our region and in central Vermont. So they'll talk to you a little bit about what we're doing and a little bit about what resources you can utilize, pull together in your workplace to support your colleagues as they are parts of our community as well. So Stephen, turn it over to you.
Thanks, Jesse. Good afternoon, everyone. I'm Stephen Berbecco, Director of the Mental Health Initiative, and I also provide counseling services for students and staff at an elementary school. And I'm here with Adrienne. We support the Mental Health Initiative, which is a collective impact program, which means a lot of all of us coming together to solve problems that any one of us would be really challenged to address directly. A mental health initiative 10 years ago would have looked very different. 10 years ago, a program like this would have brought together maybe 8 or 10 direct care providers and a handful of Vermonters with lived experience and produced a project and then done the project and then, okay, we're done, go home. But mental health today is really different. Coming out of the pandemic, the system of mental health care is much broader is much more profound than we've ever seen in the history of Vermont or the nation. So today, mental health actively involves our schools, our early childhood education, our higher education. It actively involves, as Jesse said, housing and transportation uh, and local government and state government in a way that it hasn't before. It's uh, it's it's part of what librarians do in our public libraries in a way that they haven't seen before. And that's why the mental health initiative is more than 10 people, more than 20 people, more than 100 people. We're up to close to 200 participants from a real diverse variety of sectors across Vermont, including our schools, early childhood ed, higher ed, religious groups, civic groups, transportation, housing, recovery community, and other organizations and agencies that have now seen that mental health has become one of their top priorities or their top priority in a way that they haven't seen before. And by coming together, as Jesse said, we're able to all pull in the same direction and come up with innovative ideas and projects, things that perhaps we couldn't have done all on our own. It's through these conversations we've been focusing on youth mental health, making sure that our youngest Vermonters from birth until early adulthood have access to the mental health care and services that they need when they need them. It means focusing on suicide prevention because our numbers in Vermont have been trending the wrong way for over a decade and have gotten worse coming out of the pandemic. Last year, and I hate that I know this, last year, uh, almost every month, a youth in Vermont died by suicide. And that profoundly affects the family, of course, but also the community, the school community, the local community. It ripples out. It brings all of us in a way that uh, is horrible and catastrophic. We also focus on workforce development, making sure the right people are in the right place at the right time. And more, it's clear to me and many of the people that I talk with that we need more than just more therapists. Like if we could get 200 mental health professionals to parachute into Vermont and start providing services, that would be fantastic, but that's not going to happen. Even if they were to come, there would be nowhere for them to live. Back to the housing problem. So instead, the solutions that are going to work, the solutions that we need, and the solutions that are really practical are the ones that involve all of us. All of us from whatever we do professionally, all of us from all of our personal circles, all of us working together and becoming protective factors for each other. I'm really excited about the projects that we're working on. And I want to hand the microphone to Adrian to talk about one or two of them and give you a sense of some of the excitement that we have and the excitement that's been building among our participants. Adrian?
Thank you. I was actually going to ask Aaron, can you just give me a sense of who is in the room? Because that might affect which projects they're interested in. If it's like too diverse and long, that's fine.
Maybe we could do a quick round of introductions. And I'll start. I'm Liz Gamache with United Way. And I'll hand it over to Elizabeth.
Liz Hunt. You're on mute.
Yeah. Thank you. Thank you, Liz. I'm Liz Hunt. I am the Director of Finance and Operations at Green Mountain Surgery Center. We offer low-cost, high-quality healthcare to whoever needs it.
Thank you. How about Amy?
I'm Amy Jewell. I'm our Director of Administration at the Chittenden Solid Waste District.
Thank you. Nicole. Hi, Nicole.
Hi, how are you?
Good. How are you?
Good. Nicole Bolinas. I'm the operations manager for the Lake Champlain Chamber.
Erin, let's have you introduce yourself.
I'm Erin Reagan. I'm also with the United Way. I'm the
And our-
corporate engagement manager.
And our organizer for this session. Jordan.
Hi, I'm Jordan. I am the firm administrator for LMC Law in Colchester.
Thank you. Lisa?
I'm Lisa Campion, the owner of LMC Law in Colchester as well.
Thanks. Megan.
Good afternoon, everyone. My name is Megan Masterson. I'm the assistant director at KidSafe Collaborative, and I'm also a co-facilitator of one of the mental health initiative projects.
Thanks, Megan. Let's see, we've got Rand.
Yeah, good afternoon, everyone. I am Rand Al-Badin from Jordan, and I am a fellow in the U.S. Leadership Exchange Program. And my actual project, actually, we are working with United Way of Northwest Vermont, and the action project was based on the integration between the digital mental disease and the cyber GBV. Thank you.
Thanks, Rand. And Tim. And we'll get back to Tim. He may have stepped aside for a moment. So let's see, Aisha.
Hello, everyone. I'm Aisha Raftery with United Way of Northwest Vermont. I am the Plan Giving and Major Gifts Officer.
Super. Have we missed anybody? Speak up if we have. Okay, there you have it, Adrian. Now you
Okay.
know who's here.
Thank you. That's really helpful. Seems like we have a lot of people in the Chittenden County area. And I'm actually I'm not going to put Megan on the spot. I'm just going to give her a small round of applause. We had a really great meeting yesterday. That is what, as she said, one of our projects. So we have a monthly meeting that is just focused on youth mental health, and anyone can come to that meeting. It is structured. We're working on the structure and the norms, and ask for feedback about what topics and data points people want covered. But we had about 15 people there yesterday, 3 to 4 p.m. on a Wednesday online. And we had someone from DCF, Children and Family Division locally, someone from Randolph, but who is with the Vermont Principals Association, someone from the Howard Center, someone from the Vermont Racial Justice Alliance, someone from CCV. I'm not going to read you the whole list, but it is diverse, and we have people who are there for personal and professional reasons, usually at the same time, but sometimes not. And that's okay. And if you're interested in joining one of those meetings, let me know. We just have been meeting for over a year now. And this particular, we're calling it a project. It was an action team because youth mental health is one of those 3 priority areas that Stephen mentioned. But there's definitely a need for a space like this. And because it's online, we have people from all over the state and sometimes outside of the state that join. And we send the notes out to everyone who's on the list, whether or not they come to the meeting. And as of yesterday, we had 75 people who were invited to that meeting. And some of them might never be able to make it because of the timing. Some of them are going to come every single month if they can. But it's very encouraging, even people that can't make the meeting, they'll usually send me a quick note and they'll say, I'm so sorry, I'm really interested, but I'll look for the notes. We got one from a librarian recently that was like that. So that is fresh in my mind, so I want to talk about that first. I'm also going to talk about a couple of other projects, and these are projects that have come out of what we previously called our action teams. One of them is about addressing a very specific gap when young people are leaving high school or their secondary education in the area. and they have an accommodation or some kind of special relationship, usually with someone in the school district or through the school district, that is helping them with their school and usually also things outside of school. So one of our other lovely chairs of that action team works at CCV, and she noticed a gap where people who are leaving secondary school and coming into CCV of all different ages, but especially young people, were kind of losing that connection because there isn't a relationship, usually like in a structural way, between the secondary school services and the higher ed or career or whatever comes next for people. So yeah, she had an idea to try and help with that gap. And this project is still in the early stages. We're going to meet with her later this week to talk about what we're doing next, but there's a lot of interest. And the goal of the project is to reduce barriers specifically to mental health supports as youth transition into their post-secondary lives, because a lot of those accommodations that she mentioned are about mental health more and more. And we want to encourage people to still have support and to go on to the next phase, whatever that is. We also have, for over a year now, been talking a lot about mental health first aid trainings. If you are not familiar with that, we have someone actually at United Way who is now trained to give those trainings as a leader. And it's a kind of intense, usually all day, but sometimes split into 2 days training. And it's about ordinary, everyday people, not necessarily with a clinical or even social work background, learning how to respond to someone they know or don't know having some signs of crisis or sometimes substance use, but it's meant to make more and more people in the community a little more literate about mental health and mental illness and what to do as someone who is not a professional. And as suggested by the name, like many people have done CPR or stop the bleed, first aid trainings, maybe at work, maybe in school, maybe as part of a club you did in high school. Mental health first aid is not trying to train more people to become clinicians or first responders even. It's just acknowledging that it's very likely you will encounter someone you know very well or not very well who might need a little help getting connected to resources and to a professional or just getting through the moment. So there's a lot of interest in that, in particular from workplaces, from all different types of workplaces. And we had a project to increase the number of trainers in Vermont to double it, and we're doing pretty well on that goal. And if you'd like to get connected to a mental health first aid training, please reach out to me or Stephen. And finally, I'm going to talk about a project that is specifically trying to address or shed light on some of the workforce development issues. So we're calling it Mapping the Mental Health System of Care, which means a lot of different things. But in particular, we have someone we work with who helps us track, using Psychology Today, the number of private therapists in Vermont who have availability, and a few specialty areas within that. Like, we can, assuming that it's accurate, which it is not always, but it is what we have. For example, the number of therapists in Vermont who take Medicaid, who have a specialty treating LGBTQ plus youth, something really specific like that. And that's helpful, partly so people know what's out there, and also so we can see where there are gaps. And youth mental health is one of our priorities, but also workforce development, so we can see physically, geographically in the state where there are professionals who have availability and who don't. And we're hoping to use that information and to keep gathering different types of information to have a better visual and data understanding of what the system of care in Vermont is right now, and then an adult and a youth version of that. Okay, those are the three I was going to talk about. And Stephen, if I left anything out, let me know.
Thanks, Adrian. I'm particularly excited about mental health first aid. As Adrian mentioned, it's like first aid, but first aid doesn't train you to be a nurse or a doctor. It trains you in how to respond when you see something, and also to know what to look for. And similarly, mental health first aid doesn't turn you into a therapist, as Adrian said. It trains participants to identify and respond to symptoms of mental illness and substance use disorder. It's a really powerful tool. It's a national program, and there is research that points to the effectiveness of mental health first aid in establishing protective factors for a community. You can imagine if someone has mental health first aid, then everyone around them benefits from that knowledge and those skills. It's like you go into a restaurant and kind of assume and hope that someone knows CPR or the Heimlich maneuver. And similarly, because those are protective factors for all of us. So similarly, mental health first aid helps us help each other without bringing in new therapists, without training new therapists, which I'm all for training new therapists, but we need support now. Mental health first aid is something that anyone can sign up for. It's also something that anyone can train to give workshops in. And that's why, as Adrian mentioned, one of our projects has been to ask our participants to raise a hand.
Okay.
Right. Stephen
Is-
messaged me that Teams is working, but the call just ended for him. But yeah, his point was if you're interested in becoming a trainer, that's also something we can help connect you to. And in the past, what we've done is we've used some of our project money and special funding to pay for the certification or to help offset the cost. And I will put both of our emails in the chat. And I'm also going to share something I meant to mention, which is one of the first things we completed as a project was we worked with our Working Bridges team, which is a different amazing United Way program to support employers and employees in the workplace to talk about mental health. I'm going to put the link for that in the chat. That's something that we had a lot of interest in. We were tracking the downloads for the online version. At one point, it was over 2,000 after like 6 months. So there's definitely interest. And Liz
Adrian,
and I.
could I jump in for a sec while we're waiting for Stephen to come back? I just wanted to comment a little bit on something that underpins all of what we're talking about, which is reducing stigma. And one of the things that I think is happening as more people become aware and involved of the issues around mental health, we're realizing that it's not somebody else's problem, whether it impacts you directly or indirectly. It matters to us all if our friends or neighbors are suffering. And that's why we have these great opportunities now as we become more comfortable as a community to talk about mental health issues as the stigma starts to reduce, to get more involved and become better able to support our neighbors, our coworkers. And I'll just say on the subject of mental health first aid, we've been trained here at the United Way office, and I can tell you that I was surprised and really grateful for the training when I discovered that I had a close family member who was experiencing mental health crisis. Having had the training, it made me feel much more comfortable than I otherwise would have to ask some hard questions, to connect my family member to resources that could help. And you just never know, like, just like first aid and, somebody choking in a restaurant, inevitably there's somebody who knows the Heimlich maneuver and is comfortable in doing it. Doesn't make them a doctor. And with mental health, it's sort of the same thing. As community members, we can play a role in helping one another as we become better aware and trained. It's just a great program.
I think that's the reason why we created the mental health toolkit. Again, was to empower people to feel like they're doing something, to give them resources and ability and information, so that you know what to do in terms of who to call or how to think about creating a supportive workplace culture. Because so many of us, it's like what we talk about with the schools, right? Where kids have to be at school. Most of us have to be at work. and so it's a great place to meet people where they're at, right? It's a resource, it's a place. And I think maybe pre-pandemic or historically have always thought of those things as separate spaces, right? And we've thought of issues, particularly as Liz is saying, like mental health as a stigmatized issue, that's your problem to deal with. It's not my problem as an employer to deal with. And I think maybe part of the COVID silver lining is that we have changed that. We've flipped that on its head because the integration of my workplace and my home and my community are so much clearer. I can also very clearly see and understand that my actions as an individual in a community impact others, right? And so by empowering myself, by empowering my employees, by empowering my family or others to do something and to act, we are all better off. That we've had mental health professionals say to us since the initiative launched that in the last 2 years, there has been more conversation around stigma and mental health than there have been in the previous 10 years combined. And that in and of itself is important. That in and of itself is a win, because we're willing to open up and say that this is an issue that's affecting us all. And it's impacting our ability to meet basic needs. It's impacting our ability to achieve financial stability. It's impacting our ability to support our families, right? Again, it's that undercurrent of all of these things. And so empowering you with these resources like the toolkit really gives us an ability to respond more holistically as a community. We're not asking any of you, we're not asking any of us to be the only solution. I see that Stephen's jumped back on, but Stephen, we're just talking about the mental health toolkit and some of the different resources there. And I was just going to go into it, but I see you've bumped in and want to see, the notion that we can't all do this alone, or that any of our individual actions and activities have impact on each other, and trying to make decisions that are good for the whole. Maybe you can talk a little bit about what's happening in the schools.
Thanks, Jesse. I apologize for that. I thought that all the technological problems were supposed to happen on a Friday, but I guess I got mine early this week. So here's what's going on with schools. And this isn't going to surprise you, that there is a youth mental health crisis. And it's something that that a lot of us are seeing firsthand. I don't know if you saw, my fingernails are painted because I have 2 kids in elementary school. And so I'm living it. And even for those of us who don't have kids at home, or at college, like our neighbors, our friends, our nephews, our nieces, like we're hearing about anxiety and depression at a rate much higher than 10 years ago. The most recent data from Vermont point to about 2/3 of our kids are experiencing anxiety and or depression, and that is coming out of the pandemic. And I'm not going to go out on a limb too far to say that it's because of the pandemic and the experiences that we all went through. And as a result, schools are seeing levels of behavior that they have never seen before. And a lot of schools are looking for resources and trying to bring in more resources but they're limited. I mean, they have a school counselor usually. Sometimes they have a school-based clinician that they contract with, but they need more. They need much more. There's a school in Burlington with a wait list of 180 kids for mental health services. And it's not that no one wants to give them services, it's that the system isn't prepared for this. We're not all prepared for this. A lot of schools and school leaders have made the choice to leverage recent federal funds that have flowed into our public schools to hire therapists directly. To say it's not enough to have a school counselor, it's not enough to have a school-based clinician that we contract with. We're going to hire another employee, another 2 employees, another 3 employees. Let's get some mental health therapists here full-time in our school every day. And they can afford it now because of the federal funds, which is great. But a problem with that is that, again, back to this idea of, we're a closed system in Vermont. We don't have a lot of people moving into the state. So those therapists, many of them come from our community mental health agencies. And so in solving one problem and the schools, we inadvertently create another problem.
Are you all not getting the audio now?
I
got
can
the
hear.
audio.
Liz,
Got it.
Oh
Liz,
no,
Liz
did I cut out?
Hunt's hand is up.
Yeah.
Liz,
Liz, do you,
Liz.
Yeah, Stephen, I was just wondering, because this is unfortunately something that comes up a lot with a lot of our employees. We have a lot of employees that have kids, school-age kids. And unfortunately, the mental health crisis is real. It does impact the employee's ability to show up sometime, because they need to take care of their children, and of course, family comes first. With the pandemic, obviously having turned a lot of children onto social media at much earlier ages, and they're being negatively influenced by some things. And I know there's been some trends, especially locally in the Colchester schools recently. Has there been any correlation or thoughts within the district of course, the resources, but also the implications of social media on youth during that developmental cortex phase of normal development, and the negative impacts, and any kind of thought that you know of going into like, hey, let's try to limit the social media use and get kids back to being kids? Just curious while we're on the topic, just because this is something that hits home daily for us. Thank you.
Liz, I'm glad you brought that up. I'm glad you brought that up. And there are 2 things that I can tell you about. One is Dartmouth College is convening a meeting of all of the living current and former U.S. Surgeons General. I think it's next week, actually. I think it's on the 28th, to talk about this, to talk about youth mental health, and specifically, what is the role of digital technology in the decline in youth mental health that we're seeing today. And so it is a national issue. It is highlighted in the U.S. Surgeon General's advisory about youth mental health. And it is part of a lot of conversations nationally. And I'm going to say it's not just nationally, it's internationally. We're joined here on this call by Rand from Jordan, who is studying this topic, both in Jordan, internationally, and now in the United States, joining us in Vermont for a month. Rhonda, I don't know if you wanted to say a few words about the work that you're engaged in and the project that you're working on.
Yeah, thank you. Thank you so much for all of you just to give me this chance to be in this meeting. Actually, I just first wanted to talk about maybe we could also emerge the psychological first aid into the program with a mental health first aid that would be I don't know, maybe it's gonna be like a complementary process for the first ed. That would be good because I already took the BFA, uh, just to, like working with people, refugees, living, like a trauma in a conflict area like Syria, Iraq, and all of these. So the BFA also could be, like a complementary for this process as well. The overall action plan, it was like integration between the digital mental disease, because there is a newly filed diagnosis added to the DSM-5, related to the excessive use of smartphone. And also that would be like linked to the cyber harassments and suicide attempts and thoughts. So when we can emerge these two together, we can also develop and implement a project plan to implement into the schools and university students as well, to prohibit it even more, the excessive use of smartphone, because that would lead eventually to the suicide thoughts and maybe suicide attempt. So I don't know, but this is, like hint. I'm a pharmacist. I worked as a mental health pharmacist, a pharmacy as well. So there's a lot, in dealing with people, especially refugees who has a PTSD, ASD, ADHD, all of these diseases aggravated even more with the excessive use of smartphone, especially the ASD children and the ADHD. So from this point, I would love to share more with you and gain from you as well. Thank you. Thank you, Stephen.
Thank you, Ron. And locally, a lot of schools are seeing just what we're seeing here and what we're talking about.
Yeah.
In the news recently, there have been 2 middle schools that have implemented new policies this school year to not just say, hey, please put your phone away, but all devices, like your phone, your Apple Watch, your everything that beeps. We're going to put it in a lockbox at the beginning of the day, and you'll get it back at the end of the day. And for these schools, it's more than just removing that distraction for the classrooms. It's a mental health issue.
I love that question, Liz. And because, so much of what we talk about, to me, having these discussions can be anxiety producing, and you want to move to action. There's probably not a whole lot of disagreement that social media and technology has downsides. And, as parents, we're, eager to know what's the action that we can move to. So I appreciate Stephen hearing about the school example and how maybe we can encourage that within our own school districts, be voices that way. Maybe you could speak a little bit about how we can move to action as advocates for mental health issues.
Absolutely. Mental health 10 years ago was a topic for mental health providers and those involved with therapists. 10 years ago, like a conversation would be, if you told me that you were seeing a therapist, I might ask, is everything okay? But today, if you tell me that you're seeing a therapist, I'll ask, is everything okay? And I'll probably also ask, does that therapist have any open slots? Because mental health and seeking therapy is so much more a part of what we all talk about. It's part of health. Advocates have been, beating the drum for decades about how mental health is healthcare. Mental health care is healthcare. And today, I feel more and more of us, in fact, it feels like in my world, most of us see that mental health care is healthcare. And because it's part of what we all know and what we all do, because it's part of so many of our conversations, in many ways, it's so much easier to become an advocate for it. And there's advocacy of like going to the State House and advocating that way. There's also the advocacy of having open conversations, of making sure that the people around you, the people we work with, our family members, our neighbors, our colleagues, know that it's okay to talk about mental health. And it's okay to talk about when things are difficult. A lot of what mental health first aid talks about and trains is how to have those conversations. A lot of the mental health toolkit is built around how to have those conversations. And even just being open to it, being open to what we're all experiencing, I think turns us all into advocates. There are other ways to advocate too and become part of the solution. I mentioned earlier in our time together that we have close to 200 people from about 200 different organizations working together on us, on our projects. And that's fantastic. And we would love for you to join us. That each one of the participants who is part of the mental health initiative brings a unique professional and personal perspective. And that is invaluable. In fact, critically important to building projects that not only help all of us, but don't inadvertently hurt some of us. I mentioned what's happening in a lot of schools, withdrawing mental health providers away from community mental health agencies. And that's an example of not doing it the best way, of creating challenges while also providing solutions. The more of us that talk together, the more likely we are to find solutions that help all of us. I'm keeping an eye on the time, and I'm really excited to have this hour together. And I also want to ask what questions you have. What's on your mind?
I have a question, just by way of the mapping the mental health system of care. Something that I've heard with, we work with a lot of Medicaid patients here. We work with a large LGBTQ plus population here. We do a lot of gender affirming surgeries. With that comes a lot, Medicaid requires a lot of kind of, I hate to call this, but checks along the way before a gender affirming surgery happens. I've heard complaints from patients that are just frustrated because they're at this point in their life. They're very excited for this point in their transition, but they don't have access to a Medicaid providing therapist. I know, and this is getting probably a bit too healthcare, but I know there's been a lot of work in the legislature to get Medicaid reimbursement up to support that population, to get less people to want to say no, like kind of all full here. Do you know if there's work on behalf of the mental health healthcare, which I agree with you, healthcare is healthcare, let's not separate them, but is there work in the mental health healthcare to make it more accessible for the Medicaid population to have access to those services instead of them kind of being boxed out?
Thank you for that question, Liz, because it connects to one of the projects that I love talking about, but is a little more challenging to frame. And so the short answer is yes. And that's something that we're working on. And here's a more in-depth answer. The largest marketplace for private therapists in Vermont is a website that Adrian mentioned called Psychology Today, psychologytoday.com. And that's where more therapists advertise their availability than anywhere else. That's where Vermonters are more often than not referred to when they talk to a primary care physician or call Vermont 211 looking for a therapist. And it's a great resource. They have a lot of therapist profiles. A problem with it, though, is that therapists don't always update their profiles week to week, month to month, even year to year, to indicate whether they're available, whether they're taking clients. Sometimes they indicate in one part of their profile that they are taking clients, and somewhere else they say they have a wait list. So what we did was we worked together with our data team to build a tool to scrape all of the profiles of therapists on Psychology Today every week and gather information about not only who they are, what their credentials are, how to contact them, but also whether they accept Medicaid, whether they self-identify as serving LGBTQ plus clients, and whether they actually are available. And oh, by the way, when was the last time they updated their profile? We recently worked together with Help Me Grow. It's a program of Vermont 211 that helps expecting and new parents and caregivers in Vermont, because they had a problem where they had a list of providers for perinatal anxiety and mood disorder. And they couldn't keep track of which providers are actually accepting clients. So we took their list of providers and our weekly scraping of Psychology Today, put them together, and now Help Me Grow has a tool that they can use that's updated every week to give them a list of an accurate list of who's accepting clients among their providers and how recently that provider actually said that they were accepting clients. So it becomes enormously more useful for them, enormously less frustrating for caregivers. And that's the sort of tool that we can replicate easily for other populations. For instance, as you described, Liz, populations of LGBTQ neighbors, colleagues, community members who are looking for a provider who is actually accepting clients and accepts Medicaid. That was a long-winded answer about something that I'm really excited to talk about. What other questions do you have and how does this land with you? Great. Well, I'm really excited to have had the opportunity to talk with you about mental health and the mental health system of care, about some of the work that we're engaged in, to encourage you to join our efforts, and also to be an advocate for mental health in your personal and professional circles. We can all do better by working together. And Liz, let me hand the microphone back to you.
Oh, looks like we've got another hand up from Liz, the other Liz.
Sorry, I'm just keep going here. This is something I'm
No,
really passionate about,
this
though. So
is
thank
No,
you.
this is, yeah, it's great.
Please ask away.
With I'm copy and pasted all your links, which I'm really thankful for, about the mental health first aid. I think that's fantastic in the toolkit. And this is something I'm happy to reach out to Adrian or Stephen offline about, but just coming from a smaller healthcare setting, do you ever offer this sort of training? And I guess I'm not sure if United Way does the training or if we outsource the training, but into a large group setting, like if I were to have this be an in-service to all of our clinical staff as well as management, so we all have those toolkits to ensure that we are prepared for anyone in crisis that we might see come through our doors.
Well, the United Way folks are smiling. I'm not sure who wants to respond to that, but Stephen, you handed the mic over to me, so I'll say the answer is yes. We do offer trainings, and we'd love to talk to you about how we might set something up, whether it's specifically for your staff or something more open. So you can reach out to Stephen or Adrian or to myself here at United Way, and we would very much like to help be supportive of that.
Great, thank you so much.
Sure. All right, it's getting close to the end of lunch hour. Any other questions or final thoughts? If not, we really thank you for joining us today, and thanks for your patience as we encountered a new type of a technical glitch with Stephen's power going out. That was a new one for us. And we just want to say, at United Way, we're all about doing more together. We know we can accomplish more together than as individuals, and whether it's giving money to support the programs and the issues that we offer, or becoming a volunteer, or learning more to be a better advocate in the community. It all matters, and we appreciate the engagement with you today, and we hope that we can keep in touch with you in the future. Please don't ever hesitate to reach out. Thank you, everybody.
Thank you, everyone.
Thank you.
Have a
Thanks,
wonderful
everyone.
day.
Have a great afternoon.
Bye-bye.